And so, on that note, we're going to get started with our conversation this morning. Dr. Andrew Ford, good morning to you. Well, first of all, did you have a good Independence weekend?
It was great. It was a bit too short.
I understand. I understand that, but it was good nonetheless. 49 years of independence, and
Time flies.
it really does.
Yeah.
But everybody's excited and looking forward to that golden anniversary next
It's
year.
going to be a big one.
Oh yeah, lots of special things will be happening across the country, and we look forward to sharing all that with you. The journey, it started officially yesterday, and now today we also see the start of a new season, another season, the holiday season. But it's never a season where we can't discuss things skin. So we're getting into the skin right now with Dr. Ford, and today we're talking about Morphoea. He said it
Yes,
right.
Morphoea.
Yeah.
Doug
Okay.
is really
On
good at
point.
this.
Yeah, well,
Yes. Linguist.
What is this exactly, though?
Morphoea is a localized inflammation of the skin or sclerosis, where you get hardening of the skin.
Right.
It's related to an autoimmune change that occurs in the skin, and it should be distinguished from a generalized form, which is called systemic sclerosis. But Morphoea only affects the skin, and it's an important condition that you should know about, even though it isn't very common.
Who does it happen to primarily?
Well, it happens to women more than
Here
men.
we go again.
Women are controlling many things. But here we see a very subtle form of it. The abnormality is really the darker areas on the skin, which are oval, maybe about 1 to 2 centimeters. It just looks like a darkening of the skin there, but if you try to pinch the skin, then you realize that it's tethered and held down, and you can't get it to move from there. So that one is very subtle. It doesn't affect lower down. This shows the abdomen of an individual who's suffering from it, but you can see the various forms of it. The older sections are in the center of those ovals, and they look lighter. The skin may be a bit shinier, and the darker areas, there's a bit of indentation or atrophy of the skin. And there's some examples of Morphoea. It can be, that would be the localized form where you just have maybe 2 or 3 in an area. But you can also have more than one area involved, and that's where it's more generalized.
Oh, this is
This
a little
condition,
more
yeah.
intense.
Well, this shows you a whole limb, because Morphoea can affect limbs as well. It can affect anywhere on the body, but the abnormality here is the darker areas of the skin. You can see just behind the knee on the left side, you can see that indentation, that linear indentation and darkening, but the whole hamstring area, the skin looks different, it looks more wrinkled. All the tissue on that side is kind of reduced, and on the left side here you can see the side of someone's thigh, and the variant changes that you can have darkening or lightening with glistening on some areas, and the other one is a calf area with that dark irregularly shaped plaque. But in those areas the hair and the sweat glands are reduced, so the formation of the fibroblasts really reduces these structures in the skin. The purpose of this one, where the dot is on the left, is to show you the skin that's normal. But all the rest of skin that's darker is the Morphoea.
Wow.
And you can tell from the one on the right that it's actually making a furrow that is diagonal along that limb. So in addition to affecting the skin, it also affects the fat, and it can also go on to affect the bones and the deeper structures in the skin. So Morphoea can either be superficial or very deep. And in this one from the internet of someone's forehead, you can see that lighter area that's in a line, and the bone itself has been reduced and eroded by this condition. So that doesn't happen very often. You call that coupe de sabre because it looks as though someone took a sharp knife and cut someone. You can see it radiating in an unusual pattern there just on the scalp of that individual. So it can be disfiguring. That's the important thing. And in some cases, you can have it on the face, and one side of the face would stop developing. So that's what you call a hemiatrophy, where one side of the face stops developing. So that happens mostly in children. So it's important to recognize it early. If you get a discoloration, it starts as a darker area, the skin gets thinner. You should see your doctor about it and have it looked at. But of course, if half of your face isn't developing, which is a very rare complication, then it has to be, you have to be very aggressive with it.
Is it painful?
No, it doesn't hurt at all. You may get a little itching, but there are no real symptoms associated with it. It's just that visual indentation and the hardening that's there. And of course, people worry about it because the generalized form, when it affects the face, it gives you a younger looking face initially, but then the mouth becomes very tight and you're not able to open it the way that you should.
Yeah, I was curious about that because you suggested once it starts to spread, then that particular area, you know, it hardens and hair doesn't grow in it and all of
Doesn't
these
sweat,
things.
which can be useful for some people.
Doesn't sweat either.
Yeah.
So I mean, what other kind of complications, you know, could you experience? As a
Well,
result?
most of the complications are cosmetic. Other than that, because it's just a localized form of the condition, there are no real complications. But of course, for individuals who have it, that's why we use the word morphea rather than any other term, because there's a generalized form of it which can affect all the organ systems in the body and can be a very dangerous condition to have.
Now, what causes it?
Well, we don't know what causes autoimmune conditions. There are many theories. Some people report having some sort of trauma before the condition starts, and there are also other mimics, especially if you have a transplant of some sort. There's a graft versus host mimic that looks just like it, or sometimes people get bitten by an insect and they get it, so it varies. But again, we don't know what causes it, but certainly an inflammation that occurs in the blood vessels gives out these chemicals that cause inflammation in the skin, and you get more fibroblasts being made, and you make more collagen, which is one of the supporting structures of the skin. But if you take all the fatty tissue under the skin and replace it with collagen, it actually gets harder and there's no elasticity. So everything just sticks down to the structures underneath, and as you saw, it could affect the fat, which is the layer under the skin, and also the bone.
What about complicating other existing conditions? That's always a concern.
Yes, well, it can happen in a mixed connective tissue disorder. You can have morphea along with other things and a mixed pattern. One of the important things, you saw it affecting a limb, so sometimes it can cause you not to be able to move the limb the way that you should, or it can cause what are referred to as contractures of the limb. So if you have a linear one that's going across a joint, then that can be something that you'd be concerned about.
You suggested that there's no pain and no real cause for alarm. But what happens if it spreads and it spreads to parts of the body that are pliable? I mean, and it would restrict a lot of things.
Yes, definitely. That's what we mentioned, the joints as being affected. But there is something which is controversially thought to be a form of this, which is now called lichen sclerosis. It used to be called lichen sclerosis atrophicus, but that's one that affects the genitals. So that one is very is a kind of related area. So constriction and having that in those areas can be a big cause for concern.
Okay.
How do you treat it?
Well, the treatments, there are many treatments. So like with many autoimmune conditions, we don't have a really great treatment. If you start early and start with rub-on steroids or oral steroids, it works very well. But they've tried vitamin D treatments, light treatments, even anti-cancer treatments. Sometimes you have a mixed treatment where you have a surgeon coming in and replacing tissue that's been lost, especially if it involves the face. But usually it tends to burn out in 3 or 4 years, and you're left with just an area that's lighter in color, discolored. Or in the darker skin, it can be darker in color. But you can find that if you start early and you use a very strong steroid cream from early, that the induration and hardening that you get is diminished. So, for example, the lady with the back of the thigh that you saw there going down to the back of her knee, and hers felt a lot better even though the discoloration was still there. But if the fat is involved, then you're not going to get a perfect result, but at least the hardening will be reduced.
Okay, so you mentioned that it is treatable. There are several ways, and it can go away.
Yes, definitely, but you may be left with some discoloration, but at least the tightening that you get of the skin will not inhibit function if you start really early.
Okay.
What about the challenge to the bone? If it does penetrate the bone, then how do you address that?
Well, that's the plastic surgery thing that you have to do. There are fillers and other things you can use to fill in that area so it won't be so obvious. But of course, if the bone is slightly eroded by the condition, then that's gone. But the important thing is to start early. The earlier you start, the better.
How common is this in Barbados?
It's not very common, but as you can see, 80% of those pictures are Barbadian pictures, so it's something that we do see. But usually it's just a localized form, meaning just 2 or 3 in a given area. We don't usually get the generalized form that can affect different areas. And certainly the systemic form of it is very uncommon. hair, fortunately.
Well, if you mentioned that it can also affect vaginal tissue, so who does someone go to? Do they start with the GYN? Do they work in conjunction with a dermatologist?
Well,
Things like
the
that? Or
vaginal,
something that
the
complex?
genital part is really given a different names. We like to give things different names, but the you know, the effect is the same. But some people will start either with their dermatologist or will start with the obstetrician gynecologist.
It's got to be very worrying.
But it depends on who, you know, it's something that a dermatologist will probably know more about than the OBGYN. But, you know, you can get, there are several ways to get to a point, and whoever you interface with at first, you
They'll
should
send
be
you
able
in the
to
right direction.
get something done.
And it can appear on any part of the body.
Yes, definitely it can. I mean, you saw the face and the head
Yeah.
being involved, the trunk, the limbs, so it can occur almost anywhere on the body.
Okay. But again, more commonly in women.
Yes, definitely.
And it can occur in children as well? Then?
Yes, you can get it in children. The children tend to get this linear one that can affect the face. That's the one that gets us worried, the coupe de sabre type that affects the face. But again, you know, once you do something early, it's fine.
Could it be mistaken for another condition?
Well, that's the lichen sclerosis we mentioned and the graft versus host disease. There are some mimics of it which cause induration and hardening. But if there's any ambiguity, that's where we do a skin biopsy. A small, you know, sample of the skin looked at microscopically will tell the difference. But most dermatologists can make a diagnosis just on clinical evidence.
Morphoea, that's our topic for today, getting into my skin. I hope it helped you understand a little bit more about the skin and how complex it really can be. So do your best to take good care with it, and don't be afraid to keep a close relationship with your dermatologist. Pay your dermatologist a visit at least once a year, as you would with any other doctor. Thank you very much, Dr.
Yes,
Ford,
thank
for
you.
sharing with us.
And happy December.
Yes,
The big one.
absolutely.